Hello and welcome. Let's talk about CT scan. So, what does it mean by a CT scan? Computerized tomography or CT scan is a radiation-dependent imaging technique in which a thinly collimated beam of X-rays is passed through an axial slice of tissue and extracts an array of very sensitive detectors that can distinguish very subtle differences in tissue density. It was invented by Godfrey Hounsfield in 1963. Now, indications. In trauma like head injury, chest injury, abdomen trauma, and in trauma only plain CT scan is taken. And in neoplasms to see the exact location, size, vascularity, extent and operability. Inflammatory conditions like Schwarz abscess and cirrhosis of pancreas. The advantages or strengths of CT scan: high spatial and contrast resolution enhanced by imaging, rapid acquisition of images in one breath hold, imaging of choice for the detection of pulmonary masses, and excellent for liver, pancreatic, renal and bowel pathology. Three-dimensional reconstruction allows complex fracture imaging and others. Disadvantages: there's high radiation dose and poor soft tissue resolution of the peripheries and superficial structures, and the patient needs to be able to lie flat and still. Now, abdominal conditions that can be diagnosed by CT scanning: abdominal trauma, severe pancreatitis, diverticulitis, intra-abdominal abscess, small bowel obstruction, bowel infarction, renal colic, ureteric colic, carcinoma of the stomach, tumor of the sigmoid colon, and renal tumors. Now, advantages of spiral CT scan: reduced scan time, useful in children and critically ill patients. Imaging in both arterial and venous phases is possible. Improved lesion detection. Missing a lesion is uncommon in case of spiral CT scan. Multiplanar and three-dimensional analysis like CT angiography, complex joint imaging, and facial bone imaging is possible. Now, the importance of CT scan in liver abscess. In case of very small liver abscess, there is signs symptoms of liver abscess, but by ultrasonogram, it may not be detected. For detection of these very small liver abscesses, CT scan is important. End of the topic.